Afternoon again. Welcome to BGSU. Just a reminder again to silence your cell phones, please. Thank you. Without further delay, I would like to introduce the director of the BGSU School of Nursing, Dr. Shelley Buzzard.
Thank you, Tom. On behalf of the faculty and the staff of the School of Nursing, we welcome you to our pinning ceremony at Bowling Green State University. I want to express our gratitude for your presence here today as we celebrate our newest graduates from the School of Nursing. I would like to present to you our class of 2024, led by Dr. Annette Oberhaus. All right, thank you. That was quite the procession. That's nice. Well, we're excited to have you here as we recognize our seniors for all their success over these past 4 years. I would venture to say the past 2 has probably been the most stressful after all of you. But during this challenging time, you've been taking a lot of classes, a lot of simulations, skills labs, clinical, to really become an excellent nurse. And I don't know if you know how many hours you've actually spent in school, just the past 4 semesters. So you've had 1,230 hours total, 690 hours spent in the classroom, 235 hours in the skills lab and the simulation labs, and then 305 hours in clinical. It's a lot of time, you guys. Probably felt every minute of it. Yeah. So as we venture into our last 2 days together, we're really preparing you guys. You're going to go out. You're going to get our degree tomorrow. You're going to graduate, and then you're going to soon after take your licensure exam. And at that point, you are going to get to enter the profession. And I know many of you already have jobs secured. I've heard people saying labor and delivery, emergency room, intensive care units, operating rooms. So it's really exciting to hear what you already have planned for your future and all of the patients that are going to experience you as their caregivers. So I really congratulate you for all the hard work you've done. Today we have a wonderful ceremony. We have a guest speaker, our keynote speaker, Paula Kirby. We have a student representative, Mallory Marconi. We will have Dr. Oberhaus is your representative that you voted on, and then we also will have some awards as well as the pinning ceremony. Just to give you a little bit of history of the pinning ceremony, it began in about 1860 with Florence Nightingale. And those of you who don't know Florence, she's kind of our modern day nurse, and she cared for the sick during the Crimean War. She's really kind of the pioneer for infection disease. So in our modern day, I think we can all understand that, especially after the pandemic. But she was recognized with the Red Cross Award for her service during the war. And since then, hospitals have been giving nurses pins in recognition of their expertise and the type of care that they gave to patients. And so now today, colleges and schools of nursing give pins to our graduating students to recognize them with all the hard work they've done and to signify their membership into the nursing profession. So, you guys are going to graduate tomorrow. You're going to take your licensure exam, and you are going to become one nurse out of the 29 million worldwide. And that is pretty amazing, so congratulations.
Thank you, Dr. Bussard. Now I would like to welcome the Dean of the College of Health and Human Services to say a few words, Dr. James Ciesla.
Thanks very much. I guess I have two feelings right now. One, of course, is gratitude to all the supporters of our student nurses through their journey in the nursing program. And the other, and most important, is pride. I feel very proud of you all as your dean. I pop in and out of the nursing suite and facilities here and there, and I've seen you all in simulations, and of course I said hello to you when you first started the program. So I'm very proud of you. This is a big achievement. The pin you get today, as Dr. Buzzard said, is a very, very important symbol. Nursing pins symbolize integrity, education, and compassion, I think, most of all. For nursing pins to continue their semiotic value, you have to pursue those things in your career, and I'm sure you will. Nursing is the most trusted profession in healthcare, and really one of the most trusted professions that we know of in the United States, and that's because the nurses that went before you earned that trust. So please pursue that trust, and as your career unfolds, remember these things, and of course remember your pin and remember BGSU. Tomorrow night, I'll see you. I want to give you a little bit of advice. I'm going to be the guy giving you your diploma cover. So hold it up like this, letters up for the picture. Smile, stand up straight. You should be very proud of yourself. Don't look too proud of yourself in the picture, but be very proud of yourself. They'll snap a picture of you, and it'll be a little bit of a moment in time. Someday you'll look in the rearview mirror of your life, and you'll remember all that went on today and the hard work you put into nursing preceding today fondly. Please always remember HHS and nursing and BGSU. So now I have the privilege of introducing the 12th president of Bowling Green State University, Dr. Rodney Rogers.
Dean Ciesla, thank you so much, and what a wonderful audience we have here. I'm seeing so many smiling faces, so many students that I recognize as you've come to the end of your journey here at Bowling Green State University, and you're prepared to take that next step in this journey. And I certainly want to thank Dean Ciesla, Dr. Buzzard, and all of the faculty and staff that have really built an amazing School of Nursing here at Bowling Green State University. So I do want to acknowledge all of our faculty and staff. Would you give them a round of applause, please? So there's 56 BSN graduates that we will honor officially tomorrow. Is it tomorrow? It is, tomorrow evening, yes. And this time of the year, I think all of us that work in higher education, you know, it's bittersweet. It's bittersweet because we've had a chance to come together to get to know you and be a part of this short part of your journey, your life journey. But it's bittersweet also because we know you are about to go out, and especially for our BSN students, to go out and really serve an incredibly important mission. Incredibly important mission. You know, we talk about our mantra here at Bowling Green is we are proud to be a public university, and we feel it's part of that obligation of being a public university is that we do our part for the public good. And a lot of that is driven through the graduates, the students, and you are absolutely going to do a lot of good. And we are honored that you chose Bowling Green. Because we also know in this room, not all of you, but some of you would have started your academic journey in the fall of 2020. Is that true? So you came to Bowling Green in the fall of 2020. And while I try to keep this out of my mind, that was a time where there was a lot of uncertainty about, you know, what's the next step? We were dealing with a global pandemic. We were trying to think about what the next path forward. But you know what you did? You said, no, we're going to move forward. We're going to take that chance. We're going to figure it out. And we did together. And the profession you're about to enter was a profession that allowed the whole world to continue to move forward. And so I think in many ways it's apropos to talk about not just you personally and what you did to overcome, to start this journey, and now to be here 4 years later graduating from Bowling Green State University, but also you're entering that profession that allowed the whole world to continue to move forward. Those are high expectations, aren't they? But here's what we know, is you are prepared. You are prepared to go out and be engaged and be leaders in this very important profession. And to each of you, I want to thank you. Thank you for choosing Bowling Green. Thank you for choosing this institution. So many of your family and friends are with you today, so I hope you will take a moment to also thank them for all of their support. And to those family and friends that are here today, on behalf of the university, thank you for giving Bowling Green State University this opportunity to educate your son, daughter, niece, nephew, granddaughter, grandson, whatever the case may be. We thank you for giving us that opportunity, and to each of our graduates, we can't wait to see what you accomplish. Thank you for being a Falcon, and you are forever a Falcon. On behalf of Bowling Green State University and those nearly 200,000 alums that are spread throughout the world, we're honored to our newest alums that are graduating this weekend. Congratulations, go Falcons, I Ziggy Zumba.
Thank you, President Rogers and Dean Ciesla. Our keynote speaker, Paula Spencer Kirby, is a graduate of Bowling Green State University, earning her Bachelor of Science in Nursing in 1976. As a student, Paula was a member of Alpha Gamma Delta. She lettered in women's basketball and swimming and was a member of the Women's Splashers Club. She worked her way through school and even drove a bus for other student nurses to Toledo because there wasn't other transportation available. She would wake up early, have to wear her nursing dress while driving the bus to pick everyone up, drop them off at their locations throughout Toledo before ending up at her job at Toledo Hospital. Paula began her 37-year nursing career in Toledo Hospital's neurosurgery ward and completed her career retiring from the Anthony Wayne Local School District as their nurse. We are very grateful for her continued support and connection with BGSU and the School of Nursing. And we're happy that she's here today to share her words of wisdom with you, the class of 2024. Please join me in welcoming Paula Kirby.
Thank you. And welcome, nurses, friends, and family. And I have some of my own family here. You have some of your family here, and this is a very exciting day. I am a proud Bowling Green State University graduate of the original consortium nursing program that was established in conjunction with the Medical College of Ohio and later Toledo University. I know it's UT now, but it used to be Toledo University. Let me say again, I am a proud graduate of Bowling Green State University and will always be. Soon you too will be a graduate of the new Bowling Green State University nursing program. You are starting a journey toward impacting thousands of people's lives over the course of your career. When I enrolled at BGSU, I was undecided as to what my major would be. On my 3-hour drive to BG on move-in day, I had a revelation that I wanted to be a nurse, but I didn't dare tell my mother. Back in the 60s and 70s, nurses were trained at hospital programs, and I wanted the college experience, and I wanted to get away from home. I was thrilled to discover BG had just started a BSN program in conjunction with MCO, and TU joined a few years later. So I applied to the nursing program and was accepted. And later I even got my chauffeur's license so I could drive the bus, which was a big Bluebird full-size school bus that I would drive around campus, pick the students up at their dorms, and navigating that through some of these little roads was interesting. Then I would drive to Toledo and drop them at various hospitals for their clinical experience, but I would end where I had to be. At the end of our day, I got back in my bus and I did it in reverse, picked everybody up, took them back home, and made for a very long day. Let me take a few moments to hit some highlights of my journey since I graduated in June of 1976. Yes, I'm really that old. I found my letter the other day telling me that I had passed my state nursing boards. It had arrived at my house while I was on my honeymoon, September of '76. I found it. And the scores are on here, and I went, oh, I did pretty well. I guess they trained me pretty well here at BG. What happened after that letter is amazing. Not always easy, but it leaves me with many fulfilling memories. How you learn to be nurses is so different than how I learned. How nursing has changed. You live in the information age. When I started, I saw the invention of the CAT scan, the MRI, and later the PET scan. We had basic x-rays and paper charts. Gone are the days of the white uniform, white shoes, and a white cap. Just prior to graduating, I had to figure out how to get a job. It's very different than how you do it, I'm sure. I went to the director of nursing at MCO after a clinical experience and asked if she had any openings. I thought maybe I'd apply for a med-surg position, but when I approached her, she said, yes, we have openings. We need you in the neuro ICU. I said, what's neuro? She said, oh, you'll be fine. Go to personnel, do your paperwork, and you'll figure it out when you get there. I started on the 3 to 11 shift, and the charge nurse at the time was a St. Vincent's graduate, and she'd been there about 2 years. She had an awful lot more hospital experience, and I was a little bit intimidated. I went to my supervisor, and she said, It's okay, you'll catch up. So I would come into work, 3 to 11, I'd have hot curlers in my hair, up on top of my head. I'd go through the tunnel, and I'd go up to the 5th floor, rip the curlers out, pull my hair back in a ponytail, and stick my cap on. And I can't tell you how many times we banged those caps on the trapeze bars on the beds. And back then, nurses even smoked in the nurses' station. How times have changed. You have electronic medical records, telemedicine, artificial intelligence. One thing that hasn't changed is you will have to learn on the job, just as I did. In fact, there are some truths of nursing that are still the same. One thing is for sure, you will make a difference in people's lives. I quickly became acclimated to the neuro ICU, and what happened there changed my life. I had a 20-year-old patient who was a victim of a motorcycle accident. His name was Bill. Bill was with us for 18 months and couldn't communicate very well. He'd had a cervical fracture like Christopher Reeves. Anybody know who Christopher Reeves is? Your parents probably do. He was Superman. But he had a C2 fracture and was paralyzed from the neck down. As Bill was on a ventilator and had a trach. He was fully aware, but a quadriplegic. He was cognizant, and that's all the functioning he had. He had a feeding tube, so he couldn't eat. I learned to read his lips and was one of the few who could communicate with him. Later, I became pregnant with my first child. I was Bill's primary nurse, and I would also have a couple other patients, but Bill kind of monopolized most of my time. I remember feeling like I was letting him down when I wasn't there. I got close to his family as they lived out of town and could only visit on weekends. Over time, I became Bill's family. I was worried knowing I was going to be going on maternity leave. So I came back while I was on maternity leave, and with the help of a respiratory therapist, we knew we needed to boost Bill's morale. So we cooked up a scheme to take him to the Toledo Zoo to see the Christmas trees around the world. We found a work van, a ventilator, an ambu bag, and off we went to the zoo. Bill later told me that was the best day of his life, being able to see the outside world again and to see Christmas trees. He died 2 weeks later. His family and friends established funds for continuing education for neuro nurses at MCO, and we named it after Bill. I actually was able to benefit from these funds, and I went to a convention in California for neuro nurses. I could never have afforded to go otherwise. You will make profound positive impacts on people's lives, and they will make profound positive impacts on you. My sister, who's here with me today, she told me about this PTG, which is post-traumatic growth. It's a positive psychological change experienced as a result of struggling with highly challenging and stressful circumstances. Well, it's not PTSD, but those of us who are called into the devotion of caring for patients have the opportunity to experience deep meaning and insights. Suffering ceases the moment it finds meaning, is a quote from Viktor Frankl. His book is called Man's Search for Meaning. I would be lying if I said there were never going to be difficult days. Losing Bill was one of those days. But finding and sharing his joy and seeing those Christmas trees at the zoo has stuck with me for 45 years. To this day, I don't like motorcycles, but I do love Christmas trees. My best friend Liza was a nurse with me. We started at the same time. We worked side by side as a team caring for our patients. To this day, she is my very best friend. There was an orderly, David. He later went on to medical school at MCO and became a urologist, and he's still another one of my best friends, and I treasure their friendships over all these years. I learned how important the other ancillary departments were. I fostered close relationships with the pharmacy, radiology, dietary, central supply, and housekeeping. Everyone was connected, and we were a team that made a difference because we worked well together. We had fun, we supported each other, and our patients felt our teamwork. Medical students, residents, nursing students, physicians, a teaching learning setting was where I thrived. After 3 years in the neuro ICU and the birth of my first child, I left my full-time position for part-time outpatient pediatric neurology clinic. I ran the peds neuro and adult neurosurgery clinic for the next 17 years. I estimated that I made connections with thousands of patients and their families. I grew up, and I helped raise a generation of myelodysplasia patients and a generation of patients who lived at the Sunshine Children's Home, which is a facility for children with multiple disabilities and neuro challenges. While I only worked 3 days a week, I managed to raise 5 children of my own. My youngest daughter's here with me today. While I worked 3 days a week, when my oldest was going to college, my youngest was going to kindergarten. I took a huge leap and left the comfort and safety of MCO and took a job as the nurse at Anthony Wayne Schools, my home school district. I describe my job at the school as kind of like an ER urgent care setting. I went from a pediatric neurology specialty to suddenly I'm in a general practice setting. I had to dust off my general medical knowledge. This was also the first time I had to really interview for a job. I told the administrators when I walked into the room for my interview, and there were 7 administrators sitting around a table, and I was the center of attention. I told them I would be more comfortable working with the students in the special needs rooms than the general student population with my peds neuro experience. But I came to find out that the practice of medicine knows no boundaries. I always made sure I knew what was going on in gym class, industrial tech, home ec, art classes, and of course what sports season it was, so I could anticipate the injuries that would show up in my office. I also became the dispenser of student medications, some daily and some just as needed. And if you want a good laugh, just take a look at my purse I still carry. It's like a medical kit. I've always got Band-Aids, Tylenol, ibuprofen, and maybe even antibiotic ointment in there. The other part of school nursing that I didn't want to miss out on when I left MCO was the teaching learning environment that I had at MCO. So I brought my MCO nursing students to Anthony Wayne to do their community nursing alongside of me. I not only took care of my students at school, I took care of the educators. I set up blood drives for the students and faculty, Heart Health Week during February, breast cancer awareness in October. I taught hygiene classes to 5th and 6th graders, and my sister told me to mention, if you want to know a real chuckle, ask me about the 3 Ps, which was part of my girls' talk. I served on the Epilepsy Board of Directors for over 20 years. While at MCO, I started a neuroscience nurse group for the greater Toledo area among all the hospitals and served as treasurer for 15 years. Today, I encourage you to stay positive. Do not get lost in the bureaucracy of the practice of nursing. Let negative people be like water that rolls off your back. Make lifelong friends. Get into a hospital or practice where you get a lot of exposure to different areas, and then find your passion. Your career can be expansive, like mine. Sky's the limit. Try new things. One specialty area will speak to your heart and mind. Each of you has gifts to unlock that will impact generations of patients. Take care of your resilience, your energy, and your families. Stretch yourself, stretch your goals. Find friends and professionals who lift you up and motivate you to achieve those goals. Be a lifelong learner. Never lose sight of your integrity or your goals. Inspire others to be nurses. I always got excited when students from the high schools told me they wanted to go into nursing. I figured I didn't scar them too much. We need you. I have a nephew who's a traveling nurse. I have 2 nieces who are nurses, one in OR and one in general med surg. I have a good friend who just retired as a life flight nurse. Another close friend went on to become a nurse anesthetist. And did I mention my mother-in-law was a nurse, and 3 of my husband's 5 sisters were nurses, and one of them's here with me today. And later, if your passion is teaching, become a nursing instructor. There's never enough of them around. Follow your heart, use your mind, and leave patients and their families with the imprint of your compassion. I wish you the best of luck in the days and years to come. Once a nurse, always a nurse. Thank you.
Thank you, Paula Kirby, for your inspirational words and for your support of the BGSU School of Nursing. Our next speaker is one of our graduating students. As a class, students were asked to nominate a peer to speak. Faculty were also asked to vote to select a student who has demonstrated professionalism and has shown dedication to the Fellowship of Nursing, both for our program and to their cohort. Overwhelmingly, students and faculty nominated one student to speak. I am pleased to invite to the stage Mallory Marconi.
Today, we celebrate your oh, that's not mine. Lots of papers up here. Is there? Is it somewhere else? Oh. Oh, here we go. Yep. There we go.
Good.
Thank you all. All right. That seems better. Good afternoon, fellow graduates, School of Nursing faculty, family, and friends. I'm honored to speak to you as we share this important day together. Today represents the culmination of 4 years of academic commitment and success, and specifically 2 years of focused nursing education and clinical work. 2 years ago, a colleague of my father's, a nurse, gifted me a t-shirt with the written slogan, "I can't write now, I'm a nursing school." At the time, I didn't realize how perfectly accurate and predictive such a gift was. It obviously was given by someone who experienced the rigorousness of nursing school and could understand and appreciate the dedication required in this academic field. Nursing school is distinct from many other majors. You get to know your peers quite well as you become members of a cohort. You share together in demands of the academic work. You celebrate together the successes, and you together figure out a way forward when there are inevitable failures. This program isn't for the faint of heart. It has tested our self-confidence. It involved much self-sacrifice. It led to moments of self-doubt. and sometimes we even questioned if we were ever going to get to the finish line. Simply put, nursing school is hard. You take these innate factors involved in a nursing program, and then you combine them with a program that is still in the early stages of launch at the university. As a cohort, we experienced changes and redirection, and then more modifications and more rerouting of our academic path. We know that these experiences were necessary as the university worked to ensure that when we left the program, we were well-trained and competent in the field. Admittedly, these experiences required us to exercise a great deal of skill with adaptation to change and to exercise perseverance and patience. These experiences also required us to trust in others who knew better than us the best way forward. Again, simply put, nursing school is hard. As I reflect on our experiences, it seems foretelling to what we will experience as we begin the practice of nursing. Medical care is often about defining a path forward, realizing that path isn't working or isn't producing the desired result, and then changing course, sometimes several times before the correct plan of care is identified. I think in many ways, the university and faculty were giving us a healthy dose of reality of healthcare and our need to be adaptable, tolerant, and understanding when the plan changes. We also know and realize that all of these changes were in the pursuit of excellence, and for that, we are grateful to be a part of a program that is not satisfied with average or just meeting expectations. We all have a reason or reasons why we chose the nursing field, and for many of those reasons are deeply meaningful and personal. It could be because we come from a long line of nurses in our family. It could be because we have a commitment to promoting the health and well-being of others. It could be because we have a passion for healing and comforting, or it could be because an event or circumstance started our interest in a field that we would later become our lifelong career. For me, it was an event, but not one that I readily recall, but rather was only told about. 22 years ago, I was born premature at only 28 weeks and only 2 pounds. I spent the first 52 days of my life in a Pittsburgh hospital NICU. I was on a ventilator, had a brain bleed, and a host of many other complications from being born 3 months early. My entry into the world wasn't one that was the traditional newborn celebration, but was met with tubes, tests, and a lot of worry. My mom can tell me that. It is during this time, however, that I was cared for by a team of NICU nurses who attended to my every need. It was a nurse who taught me how to feed. It was a nurse who adjusted my oxygen levels until I was able to breathe successfully on my own. It was a nurse who addressed my struggles with apnea and bradycardia, and it was a nurse who provided support, comfort, and hope to my parents when the days were bleak and they often had little. These nurses made meaningful differences in my life, as I am sure they did countless other patients. It was these experiences that shaped my decision to pay it forward through a career in nursing. Nurses change lives. I know they did mine. Anytime a chapter of our life closes is a time to consider gratitude for how we got to this point. To the faculty, there are few academic programs that allow students to become so connected with their professors as does nursing school. We are not one of thousands of program graduates, but rather you know us by name and know our talents and our areas of opportunity. We are so fortunate to have this level of connection and support, which has ensured our successes and promoted nothing short of excellence. You have challenged and stretched us. You have watched us shed a few tears in frustration, disappointment, and self-doubt. Your lectures have been many and on repeat because we know repetition is often the key to learning. And while Professor Martin could not be here today, I share with you that because her lectures have been on repeat in my house so much, my roommates and I have made her an honorary roommate. You have not made this experience easy on us, nor you should have. The work that we do is vital, and there is a lot at stake with us ensuring that we do it right and well. Know that the rigorous nature of the coursework, that not accepting less than our best, and that testing our endurance and aptitude for change has made us better students, better people, and will make us better nurses. Thank you. To our preceptors, thank you for your commitment of time and your talent in showing us how to practice the skills of nursing. You choose to serve in this role and to help the next generation of nurses become competent and confident. You have showed us patience and understanding as we've learned, and you gave us room to grow and develop. Ensuring the future of success of the field is a commitment that you have taken seriously, and one day, when we possess a similar level of skill and competency, it will be our turn to give back in the same way. To our family and our friends, we have achieved this milestone because of your support and sacrifices. Many of you have contributed emotionally and financially to our success, and without it, today might not have been possible. Some of you initially helped us choose nursing as a career. Some of you have convinced us to stay in the course when times were tough and we considered abandoning this work. Some of you were the first call we made when we mastered a checkoff or did well on an exam that seemed so overwhelming, and all of you have decided that this day was meaningful enough to be present. For me, nursing school became a family affair, so to speak. I would often call my mom and have her remain on the phone with me while I recited my course notes and reviewed aloud my test material. I know that she wasn't always listening in detail, but occasionally would speak up and say, "You really need to know all that?" I believe my peers have had a similar experiences of times when our family and friends would go above and beyond to support our success. There aren't enough thanks for all that you have done for us, but hopefully having a nurse in the family will allow us to pay it forward for the support that has been extended to us. As I look out to my peers, I see a room full of ER nurses, labor and delivery nurses, ICU nurses, med-surg nurses, behavioral health nurses, and NICU nurses, among others. I recognize that even though we are closing this chapter that has allowed us to experience both amazing opportunities and critical challenges, a new set of opportunities and challenges await. During times when things seemed less hopeful because the work was difficult, I received the valuable advice to trust the process. It is advice that we will inevitably need moving forward, as there is still so much that we don't know that we can only learn over this course of time. As I wrap up, I will leave you with this quote from Winston Churchill regarding both the success and failure we will certainly experience as new grad nurses. Success is not final. Failure is not fatal. It is the courage to continue that counts. Thank you.
Thank you, Mallory, for those encouraging words and really very inspiring story and presence here today. On behalf of the Student Nurses Association, Vice President Jada Murphy and Public Relations Chair Carrington Mallory would like to share a reflection on the senior year. So Jada and Carrington.
Wow, there's a lot of people when you look this way. Hi, I'm Jada. I'm the Vice President of S&A.
And I'm Carrington. I'm the Director of Public Relations.
As part of the Executive Board, we are excited to share how successful the past year was for our organization. The Executive Board oversees the organization's strategic planning and decision-making and are voted into office by members. Graduating seniors who served on this year's Executive Board with us are President Mallory Marconi, Event Coordinator Kinsley Neesmith, Community Service Chair Dylan Krogel, and Treasurer Maren Klaus. If you could all stand up.
I want to give you a round of applause.
Yes.
Our faculty advisors were Professor Flewelling, Dr. Oberhaus, and Professor Kay. If you guys could also stand up, we want to give you a round of applause. The Student Nurses Association, or SNA, is a student-run national organization for nursing and potential nursing students. SNA is committed to developing the future of nursing by promoting the professional development of nursing students, giving them the ability to network, access opportunities, and gain leadership experience.
In the past year, SNA has organized many events in and near BGSU. The welcome ceremony SNA held had more than 40 attendees ranging from pre-nursing students to senior nursing students. During this event, we had pizza, pop, and games where people got to mingle and meet each other.
We also had a resume and interview prep. This was wonderfully put together with a lot of help from Kinsley. Hospital representatives came in to interview seniors and give us feedback on what to improve on. These hospitals included, were not limited to, Mercy Hospital, ProMedica, Wood County, and Cleveland Clinic. There were also advisors there from BGSU who helped with resumes as well. Many of us printed off our resumes, and they were able to review them and tell us what we could improve on.
The SNA Nursing Survival Guide was an event put on for anyone, whether they were considering nursing school or in nursing school. The executive board sent in study tips that were put in a PowerPoint and presented to those who came.
Kinsley and Mallory were able to go to the OH SNA conference at Capital University. This was a great opportunity for them to gain more knowledge about our organization and share that knowledge with the rest of the board.
The Narcan training event had 30 attendees where we got to learn how to administer Narcan in emergency situations and got to raise more awareness about addiction.
We also had a flu shot clinic with help of our community service chair, Dylan. We were able to get 33 senior nursing students to administer flu vaccines to BGSU staff, students, and the citizens of Bowling Green.
Our fall bake sale included a lot of yummy goodies that were brought in by not only the executive board, but our advisors too. So shout out to Dr. Oberhaus and Professor Flewelling. Those were great. We had 4 fundraisers this year at Rapid Fire, Panera Bread, Penn Station, and Raising Cane's, where we had the opportunity to raise money for SNA.
We had another welcome event in the spring because this spring, the School of Nursing admitted their first ever spring cohort, and we wanted to make them feel just as included as the cohorts before them. The executive board introduced ourselves, what SNA is, and of course, there was snacks for everyone.
The biggest event we put on this year was the SNA Nursing Career Fair. We had 14 hospitals come in and talk about their job and internship opportunities. We had over 100 attendees. Mallory and Kinsley were the driving forces behind this event. These facilities included Blanchard Valley, Cleveland Clinic, Dayton Children's, HCF Management, Magruder Hospital, Mercy Health, Mount Carmel Health System, Nationwide Children's, Northwest Ohio Psychiatric Hospital, Ohio Health, Ohio State Wexner Center, Parkview Health, ProMedica, University Hospital, and U.S. Army Healthcare.
The last event we had this year was held during our lab classes. This is where we were taught what to do in emergency situations and mass casualty events. We learned how to apply tourniquets correctly and how to pack wounds. We achieved so much during this year, and we cannot wait to see what the future holds for this organization.
And finally, we just want to thank the SNA members because we couldn't have done it without you guys. So thank you.
Thank you, guys.
Jada was right. There are a lot of you out there. Okay. This is my last chance to say to these students, hello, beautiful people. I have a pillow in my office that says, hello, beautiful people. My daughter made it for me because I like to say that to my students. I'm Dr. Annette Oberhaus. I'm delighted, honored, and even humbled to have been selected as your faculty representative this year. And in honor of all our graduates, I don't know if you can, I'm kind of short, but that's my original pin for my nursing program. And I don't think I'm going to tell you what year that was, but I know none of my students were born then, so. We've been through many hours together in the lab, sharing in joy and stress and trials, but this is a time of celebration. You're transitioning from being students, and it's kind of bittersweet for me and for the rest of the faculty. And now you're becoming our peers. I'm sorry to see you go, but so excited for what lies ahead of you. I, and along with the rest of the faculty, have the utmost confidence in you and your bright futures. We will miss you. I jokingly say I wish you weren't graduating, but I am happy for you, but I will miss you definitely. We know that you are meant to do great, good things across Ohio and across the nation wherever you go, and we encourage you to never stop learning or sharing your talents and skills. Please know that we are always here for you, even after you've begun your careers. Actually, just 6 months ago, one of my students from 10 years ago tracked me. She heard I had gone to BGSU. She tracked me down through the BGSU website and just dropped me an email and said, "Hey, Annette, I just wanted to let you know what was going on with my life." That was so fabulous. So never, ever hesitate to drop me an email or anybody else and let us know what's going on with you, okay? We are also proud of how much you have learned, how you've grown, and you've pushed yourselves throughout these past 2 years. We have several awards of recognition to present this afternoon. So recipients, please join us on stage to accept your certificate. And if the audience would please hold your applause until the students have all received their certificates. Do you have your, yes, okay. Professor Mitchell is going to give you your certificate. The first award to be presented is the Distinguished Academic Success Award. To be eligible, a student must have maintained a minimum cumulative GPA at or above 3.5 in their BGSU courses. Our sincere congratulations to the following students: Hannah Bolden, please come forward when I call your name, Alexis Bowen, Peyton Fickus, Julissa Hernandez, Carly Hughes, Marin Kloss, Madeline Loyacono, Michaela Marche, Kinsley Neesmith, and Natalie Winkle. I should have prepared jokes to tell while there was a holdup. I didn't want to spoil this surprise by asking her to stay on the stage. However, the Academic Scholar Award is presented in recognition of the highest GPA in our nursing program through the end of the third semester of our BSN program. And congratulations to Marin Klaus for this impressive achievement. It's just like at Christmas when you take a picture with your family, nobody knows where to stand. The next award is for Cohort Fellow. The nursing cohort was they were surveyed, and they asked the seniors to select the fellow students who they felt best represent their cohort and who they would like to represent the class of 2024 in the future. I invite Dylan Krogel and Mallory Marconi to the stage to receive this award. We look forward to seeing you at future celebrations. Oh, there he is. Students were nominated for the Excellence in Clinical Practice Award by any clinical faculty who taught a rotation to current seniors during the program. Faculty selected Ilsa Fredenberg and Emily Taverna for this recognition based upon the comments made by the nominators. Clinical practice for a nursing student is both terrifying and exhilarating. It's a time in a nursing student's life to apply to a real patient all they have learned in their classrooms and the skills labs and simulation labs. There's no doubt that the many patients both Ilsa and Emily have cared for over these past 2 years have seen the making of an impressive clinician. Ilsa's astute attention to detail allows her to quickly identify the most urgent need of a patient and with unwavering confidence intervene appropriately. Emily's drive to learn is clear in every situation, constantly improving evidence-based practice in the care of live and simulated patients. Even in unfamiliar patient settings, they have shown innate knowledge to apply the fundamentals studied will assure safe, effective, and quality patient care. Like Florence Nightingale carrying her lamp, they will bring light to each patient cared for. Clinical judgment is a critical area in the future of nursing. Clinical judgment is defined as an interpretation or conclusion about a patient's needs, concerns, or health problems, and the decision or actions the nurse takes to modify their nursing care to improve the patient's response. Clinical judgment is a trait all nurses strive to achieve in their practice. The criteria used in evaluating the Exemplary Clinical Judgment Award are the possession of exemplary clinical judgment skills, which are noticing, interpreting, responding, and reflecting, the use of these clinical judgment skills to make decisions regarding patient care, excellent communication skills, outstanding skill performance, and reflecting on actions to improve one's practice. We're proud of all of our students' clinical judgment and would like to highlight those who have excelled in this area. On behalf of the faculty, Maren Klaus is the recipient of this award. Wise beyond her years, this natural-born leader epitomizes exemplary clinical judgment. Clinical judgment is considered an essential skill in the nursing profession and oftentimes can be both complex and ambiguous. Maren's innate ability to break down the details of a patient's symptoms, assessment, and medical history while simultaneously maintaining her view of a patient as a whole being is nothing short of remarkable. She does all of this with her calm, confident demeanor that makes the arduous skill and art of nursing look easy. The Heart of Nursing Award was a difficult choice. The best challenge is to identify 1 or 2 students out of such a brilliant group of future nurses who we see all going on to provide the best care to their patients and truly make a difference in the lives of so many people during their careers. Sierra Cousins was selected based on her clinical faculty's nomination for her display of compassion for her patients in the clinical setting and faculty witnessing her advocacy for her patients when she felt it was necessary. This was shared to me by Sierra's clinical faculty. Sierra spoke up to a doctor to ask him to raise his voice because their patient was hard of hearing. She held a patient's hand prior to a procedure that was frightening for the patient. Sierra's heart was evident in these interactions, and we are confident of that her future patients will feel this compassion on a daily basis. Madeline Loyacono was selected based on her actions in a challenging scenario which highlighted her overall demeanor and empathy with patients. Her clinical faculty shared that she was assigned a very difficult patient who had refused everything that put forth before them that day. Madeline was able to sit down, talk with this patient, and figure out what the patient's needs were. All the patient wanted was someone to listen to him. This is a direct quote from her clinical faculty. She has some of the best therapeutic communication I have ever seen. After Madeline talked with the patient, he got cleaned up, he took all his medications, and was more cooperative. She's going to be such an empathetic and amazing nurse, and we are sure our patients agree. I think I'm running out of awards, so hang with me. The Leadership in Nursing Award is for a student who demonstrates leadership, motivates, mentors, and prepares other students to lead, participates, and gives back in community activities, and embodies the ethics and values of nursing. The recipient for this award is Mallory Marconi. There are several qualities of a leader integral to the skill and art of nursing. These include empathy, humility, creativity, accountability, and integrity. Mallory holds these qualities in spades. Her leadership is a quiet and consistent type that's always choosing to lead with her heart. Amidst the many transitions this cohort has experienced in the past 2 years, Mallory's positivity and kindness guided her classmates as they navigated through the changes to come out stronger than they imagined. Through Mallory's leadership, this class now knows you're braver than you believe, stronger than you seem, and smarter than you think. That is a quote from A.A. Milne. Okay, our final award is for, yes. Thanks for reminding me. Our final award is for professionalism in nursing. Selected by the faculty, this student exemplifies professional standards and is a positive role model, possessing excellent communication skills and using evidence-based practice to institute quality and safety in patient-centered care. The recipient of this distinction is Savannah Morris. There she is. Florence Nightingale's pledge includes the words, "I will do all in my power to maintain and elevate the standard of my profession. With loyalty, I devote myself to the welfare of those committed to my care." Savannah began living this pledge as a nursing student. Not only has she devoted countless hours to her studies, but also to community service. At every School of Nursing open house, Savannah was there leading prospective new students through the School of Nursing halls. Her dedication to her studies and giving of self were a prelude to the dedication she will have to her patients. In every course, whether it was theory, skills lab, the simulation lab, or clinical, Savannah remained diligent, always kind, always staying the course, something only a true professional can do. Congratulations to the class of 2024 and these special distinct recipients.
We will now begin the pinning portion of our ceremony. Students and their pinners will join Dr. Lisa Jacobs, Simulation Lab Coordinator, and Emily Nidzwicki, Associate Teaching Professor, on stage to receive their pins. On the screens, you'll see the student's name and what their plans are after graduation. Please hold your applause until the students have all been pinned.
Good afternoon. We thank you all for coming today to join us in this huge, wonderful celebration. It's with great pride the entire faculty of Bowling Green State University School of Nursing awards each of you with your nursing pin. The pins you received today officially welcome you into the profession of nursing and signify your commitment as a BGSU graduate to the public university and our commitment of serving the public good. Okay. Justin Allen. We'll get it down here. Olivia Baptista. Hannah Bolden. Alexis Bowen. Jamie Bradshaw. Hannah Brose. Alexis Brzezowski. Madeline Kosler. Sierra Cousins. Jillian Crawford. Jeremy Davidson. Emily DeVore. Lindsay Donaldson. Madison Duffield. Addison Ernst. Peyton Fickus. Chloe Foster. Sorry. Allison Foster. So sorry. Sorry about that. Allison. My apologies. Chloe Foster. Ilsa Fredenberg. Rachel Garmatter. Caitlin Gasson. Madison Geldine. Brittany Grames. Anna Greenhagen. Congratulations. Ashley Janiza. Julissa Hernandez. Jashanti Hicks. Alexa Huntingford. Congratulations. Carly Hughes. Marin Klaus.
Grace Emily Rose Nitz. Dylan Krogel. Leah Lee. Madeline Loyacano. Carrington Mallory. Michaela Kennedy Marche. Mallory Lane Marconi. Zoe Mazer. Cagney Taylor McGurk. Bailey Joy Mohan. Savannah Morris. Jada Murphy. Kinsley Neesmith. Caitlin Marie Niehaus. Markea Page. Jaden Mackenzie Perez. Kayla Reeves. Lauren Reeser. McCartney Robinson. Dakota Grace Ryan. Mackenzie Rose Schmidt. Ashton Schneider. Emily Taverna. Danielle Weaver. Natalie Winkle. Mallory Witucky. We congratulate each of you on this amazing accomplishment and appreciate everyone that has played a pivotal role in supporting these new nurses. Congratulations again, class of 2024.
Just wait a couple seconds till everybody gets back in their chair. Okay. Well, as our seniors, our last few are just sitting, I'm going to actually ask my seniors to please rise. If you recall back in August when we had our return to school welcome back ceremony, we did the lamp lighting and we did the Florence Nightingale Pledge. So today I would like for us to renew our Nightingale Pledge, and the statement is up on the PowerPoint slide for you. So we'll all say that together. I pledge myself here to practice my profession with integrity. I will strive to maintain and elevate the standard of nursing, both as a science and as an art. I wholeheartedly recognize the importance of high standards of care and of personal accountability. I devote myself to the healing, protection, and welfare of those committed to my care. I accept a duty to work for the improvement of health in communities in which I live and work. I will hold in confidence all personal matters committed to my keeping and respect the privacy of medical information. I will act with compassion in ethical matters. I will not knowingly administer or consume a harmful substance. I commit to interdisciplinary collaboration and lifelong learning. I fully acknowledge the seriousness of the responsibility that I accept in my calling and the significance of this pledge that I say today. All right, congratulations to you all. I'm pretty sure you can see how proud we all are of you, all of the faculty, the staff, all your family members. We're just so proud of all of your accomplishments these past 4 years. As Dr. Oberhaus said, it's kind of bittersweet because we don't want to see you leave, but we know you have to go out into the world and take care of our patients. So congratulations. And lastly, what we're going to do next is have all of our seniors exit with Dr. Oberhaus, if you want to come up. And we'll exit back through the balloons, and family and friends, you can stay. We've got food and beverages in the back while our seniors go out and take some pictures. So if you want to enjoy some time and mingle. Thank you all for coming. Oh. Dr. Oberhaus and the seniors, can you go out the other entrance, please? I don't know if they heard me. Oh, they didn't hear me.